Hey there, and welcome back to another video with Better Speech. My name is Lenora Edwards, and I am a board-certified speech-language pathologist. In today's video, we're going to talk a little bit more about phonological disorders, the difference between an articulation disorder and a phonological disorder, and how speech therapy can help. Let's get started.
Hey there! Before we get into today's video content, I want to go ahead and remind you to subscribe to our channel, Better Speech. And after you watch the video, if you found it helpful, go ahead and click that like button, comment down below, and don't forget to share with your family and friends. Also, visit us at betterspeech.com for more information. Now, over to the video.
Now, first things first, when we hear the phrase speech sound disorder, what we're actually hearing is a blanket term, and this is often used among professionals, sometimes teachers, sometimes physicians, and all it simply means is that there is concern for your child's language development. Now, whether that be difficulty in learning, articulating, or using sounds, or even sound patterns of that language, that's all it simply means, that there is a concern in language development. Now, a qualified speech-language pathologist is able to assess and determine the most appropriate treatment plan for your little one. In this case, when we're talking about an articulation disorder, what we're actually talking about is that there is difficulty at the individual speech sound level. When we're talking about a phonological difficulty, we're talking about the difficulty at the clear and consistent production of the patterns of the sounds in that language. Now, sometimes for articulation, it might be one sound, it might be several sounds. Phonological, it's the patterns of those sounds, and we'll get to that in just a moment. When we're talking about articulation disorders and phonological disorders, they are similar, and therefore they are often confused and sometimes misdiagnosed. But there are some key characteristics that are really helpful to determine phonological processing disorders. Now, they include significantly decreased speech intelligibility. When your little one is talking, it's very difficult to understand them. Unusual articulation errors, and even common patterns of speech errors. Those are all really good indicators of a phonological processing disorder. Now, to understand phonological processing disorders, we must first understand phonological processes. Phonological processes are simply the natural way that children, and when we first started to learn language, simplified our language. If you think of an adult and a fluent speaker, speaking as clearly as we do takes quite a bit of skill. There's a lot of coordination and a lot of movement, and none of which are we thinking about our tongue, our lips, our breath, our jaw, or our voice. Now, for little ones, because they're learning to understand language, they're also learning to express language. Therefore, they naturally simplify words to make it easier. This process is completely normal and fully expected. I'm going to share with you a few of the processes that we do see, but also ones that we don't see as often and what age range they should typically eliminate by. For the first, final consonant deletion. Now, this is when the final consonant or consonant cluster is left off, such as da for dad or ma for ma. We typically see this eliminate by the age of 3 or 3.5 years of age. Now, initial consonant deletion, when the first consonant or consonant cluster is deleted, such as oi for toy or uk for chuck. This one's a little more atypical, though, of a process that we see. Now, let's not forget reduplication, when a complete or incomplete syllable is repeated, such as wah-wah for water. This typically eliminates by the age of 2.5 to 3 years of age. And lastly, cluster reduction, when all or some of a consonant cluster is deleted or substituted, such as boo for blue. Now, this typically eliminates by the age of 3.5 to 4 years of age, but this also depends on the sound. So, for example, if this is a sound, this might not completely eliminate until the age of 5. Now that you know a little bit more about little ones presenting with phonological disorders, what exactly would treatment look like? Well, treatment, as always, will be based on your child's skill set and developmental level. Now, that being said, the overall goal of treatment is to improve speech intelligibility. This will be accomplished in 2 ways. 1, we want to make sure that your child knows how to say the sounds correctly. And number 2, we want to make sure that your child is able to organize the sounds of their language in the correct pattern. As always, if you have questions or would like to speak with a speech language pathologist, please don't hesitate to reach out to us at Better Speech. We offer a free 15-minute consultation where we will do our very best to answer any and all of your questions and to offer you more guidance from there. We hope you found this video helpful. Be sure to follow, like, and subscribe for more. And as always, stay well, and we'll see you next time.